fixing what's broken with the current healthcare system. And if we can come together and stop using Obamacare as just a political punching bag and focus on the real issue, and that is how do we make it more affordable for all Americans, not just those in the individual plans or in the exchange or where have you, but all Americans, there would be wide agreement here across the aisle to do that.
Let me take my time back. My point is, what we've got, I don't care how you measure it, it works for some, but most it doesn't work. And that's why I think we've got to go down a different track. I'd love to see us work closely together on some of this stuff, but the bottom line is we've got to go down a different track because it's bankrupting the middle class, and I yield back.
Does anyone else wish to strike the last word?
Mr. Chairman, I move this.
Recognized.
Thank you. I move to strike the last word. Just to follow up on this conversation, again, we're onto something here. Is that if we start putting our guard down a little bit, get in the same room and start talking to one another, you'd be surprised how much common ground there might lie when it comes to trying to fix a healthcare system that is failing too many people. I think you're going to get wide bipartisan agreement with that. But there are also some key important things that are a part of the Affordable Care Act that you all apparently are very eager to repeal that can help bend the cost curve. Delivery system reform, going to more integrated, patient-centered healthcare delivery system with accountable care organizations, medical homes, bundling payments, these alternative payment models that are moving forward now because of the existence of the Affordable Care Act to get us better outcomes at a better price. Payment reform, that was a key feature of the Affordable Care Act, so that we're paying for the value or the quality or the outcome of care instead of the fee-for-service system, which was bankrupting America because it was based on more tests, more procedures, more things, leading to worse results, and we can't afford that anymore. That's a key feature to the Affordable Care Act, too, that hasn't been discussed at all today.
Will the gentleman yield?
And just one final point, too, and I know Ms. Del Benny from Washington State was talking about what more we can do to that 93% of small business owners in Florida, because I haven't met a small business person in my district who wouldn't love to be able to provide affordable health care coverage to their employees. And yet we know that the tax credits under the Affordable Care Act going to small businesses have been inadequate. They haven't been enough, they're telling us, and they've been too complicated for them to figure out in order to pass that on to their employees so they can extend health care coverage in their small business. It's another, I think, area of potential bipartisan agreement that we should be focused on. But the fact is that per capita spending in health care today is at a 50-year low, at a 50-year low right now. So something is gaining traction. By the end of this year, 50% of Medicare payments will be value-based and no longer fee-for-service based. And the cost of Medicare is going down. In fact, again, the Congressional Budget Office, and a large part of this is Medicare savings, is showing a deficit reduction of $300 billion over the next 10 years under the Affordable Care Act. But I'm not going to be sitting here defending the Affordable Care Act as something that's a perfect answer to the complexity of the healthcare system. Clearly it isn't, but I think I'm hearing from you a lot of area of potential overlap, and I'm happy to yield to you.
Let me just say this. The ACA, 11 million people, some people have benefited in that space. Medicare, I think they have held to some extent the cost. But everybody else is getting killed. And my point is that it's not just about what's happening in the ACA, it's also about health care in general. And I can just tell you, Blue Cross Blue Shield in our state, I've talked with the executive, the CEO there multiple times. Because they're not doing well in the ACA space, it's costing them a lot more than they thought. They're having to jack everybody else's premiums up along with it.
And reclaiming my time.
That's why the cost has gone up so much.
Reclaiming my time, and I'm going to yield in a second to my friend from New York, but let's also be honest with the American people, that a lot of what has gone to increase out-of-pocket expenses for employees has resulted in a cost shift that businesses are making on their workers. They're sticking them in these high-deductible health insurance plans, which has absolutely nothing to do with the Affordable Care Act. And your response to it is try to increase health savings accounts, which is great when people have disposable income that they can put in it, but it doesn't work at all to lower-income people who don't have that disposable income. So that clearly is not going to be the answer moving forward in regards to the cost shift that employees are experiencing. And you all have been fond of trying to lay that at the doorstep of ACA when that has just been a business decision that's been going on for a number of years. I promise to yield to my friend from New York first.
I thank the gentleman from Wisconsin. I think one of the most salient points you made is this provision before us now does nothing to bend the cost curve at all. Nothing at all. This provision, and we're going to tone it down a bit, I guess, overall, and I'll do my best to do the same as the Boykin Queens can do, but this provision incentivizes giving pay increases to corporate executives and gives the company the ability to deduct that cost. That's why Mr. Barthold has reported it costs anywhere between $400 billion and $600 billion. Mr. Barthold has said that to us. It's going to be exploited. It will be exploited. It will give the opportunity for enormous pay increases to people who don't need them, at the expense of, in some part, helping to bend the cost curve. So I appreciate the gentleman, and I yield back to him.
And whatever time I remain, Mr. Chairman, I yield to you if you want to make a last-minute point.
My only point was that we just got finished blaming the Cadillac tax for pushing costs onto hardworking men and women, and which I believe is right and agree with. And then we just absolved the Obamacare from that same action. The truth is, Affordable Care Act has driven up costs and out-of-pocket costs for all Americans. We are, as we look to complete deliberation on the first of 5 subtitles, does anyone wish to strike the last word?
Mr. Chairman, I don't believe I can strike the last word, can I?
No, sir.
I'll just point out that you're 2 for 7 in terms of people speaking out in support of this particular provision.
So if there are no further amendments, questions on the adoption of the amendment in the nature of a substitute, all those in favor say